Welcome to The Explainer. I am thrilled you're here today because we're going to unpack something absolutely fascinating. We're exploring the science of iontophoresis, which is commonly known as the invisible needle. It's this ingenious method of transdermal drug delivery that honestly sounds a bit like science fiction, but it's actually grounded in some beautifully simple biophysics. To kick things off, think about this for a second. How exactly do you get medicine deep into tissue without jabbing someone with a needle? Historically, if a clinician wanted to deliver a concentrated dose of an anti-inflammatory or a localized anesthetic, they had to use a hypodermic needle. And we all know injections come with a ton of baggage, tissue damage, fluid infiltration, and of course the sheer anxiety and pain of the needle itself. But what if we could just bypass all of that physical trauma entirely while still getting the drug exactly where it needs to go? Well, enter iontophoresis. The word itself comes from ion, meaning a charged particle, and phoresis, meaning transfer. So we're literally talking about the transfer of ions. It is a completely non-invasive way to propel high concentrations of a charged medication right through the skin using a tiny, highly controlled electrical charge. And surprisingly, this isn't some brand new cutting-edge idea. The basic concept actually dates all the way back to the 1700s, though it really picked up clinical steam in the early 1900s with a scientist named Leduc. So in plain English, we are using electric current to literally push medicine through your skin. Okay, let's dive into this. Here's our agenda for today. First, the principles of iontophoresis. Second, therapeutic uses. Third, patient safety. And finally, clinical setup. Starting with Section 1, Principles of Iontophoresis. Let's look at how this invisible needle actually works. It all comes down to a super basic rule of biophysics, electrostatic repulsion, like repels like. The drug you're trying to deliver has to be ionic, meaning it holds a charge. You take that drug, put it under an electrode with the exact same charge, and turn on the juice. The active electrode heavily repels the drug molecules, driving them away from the pad and straight down into the skin's pores. And it mostly travels via the sweat glands and hair follicles, because the very surface of your skin, the stratum corneum, puts up a massive amount of electrical resistance. These ions typically penetrate to a depth of less than 1 millimeter, creating a little subcutaneous depot where the medication can then diffuse deeper into the tissues. Now, you do have to be careful because the two different electrodes interact with your body's chemistry in very different ways. You've got the anode, which is your positive electrode, usually colored red. Because chloride ions from the skin migrate toward it, it creates a weak acidic reaction, specifically hydrochloric acid. On the flip side is the cathode, your negative black electrode. Positive sodium ions rush toward it, reacting with water to form sodium hydroxide, which is an alkaline reaction. And here's the catch. Alkaline reactions are much harsher on the skin and way more likely to cause irritation. So clinical guidelines usually recommend making that negative cathode pad up to twice as large as the anode. This spreads out the current density and protects the patient's skin. Moving right along to Section 2, Therapeutic Uses and Indications. So when do clinicians actually pull this tool out? Well, this table highlights some of the heavy hitters. If a patient comes in with stubborn inflammation, like Achilles tendinitis, a therapist will likely use dexamethasone. It's a powerful corticosteroid, and since it carries a negative charge, it goes right under that negative black electrode. Need to manage acute pain? You drive lidocaine in using the positive electrode. Dealing with calcific tendinitis? Acetic acid works wonders for breaking up those calcium deposits. But honestly, my absolute favorite application uses just plain old tap water. By using tap water and simply reversing the polarity halfway through a session, clinicians can effectively block sweat glands to treat hyperhidrosis. It's such a versatile, completely life-changing therapy for people dealing with excessive sweating. Which brings us to Section 3, Patient Safety and Contraindications. Understanding when not to use this is just as crucial as knowing when to use it. Let's rapid-fire the absolute contraindications. Because we are dealing with active electrical current, you absolutely cannot use this on patients with pacemakers or electrically sensitive implants. It's avoided during pregnancy because the effects on a fetus are still unknown. Never, ever apply the electrodes over damaged, broken, or recently scarred skin. It should never cross the chest, the brain, or the eyes. And finally, ensure there is zero metal jewelry or metal implants in the treatment area. Electricity is lazy, right? It takes the path of least resistance. Metal or broken skin offers zero resistance, which means the current will bottleneck right there and cause severe burns if you ignore these warnings. Now, even when everything is done perfectly safely, a little bit of a skin reaction is totally expected. Patients will often get what's called transient erythema, basically a uniform red square right under the pad from all that increased local blood flow. It's harmless and usually fades within 8 hours. However, you have to warn patients that actual severe chemical burns can happen if the current is cranked too high or if their skin wasn't properly scrubbed of oils and dry flakes beforehand. Those oils create dangerous, low-resistance channels for the electricity to arc through. All right, let's look at how all this comes together in Section 4, Clinical Operations and Setup. Here is the step-by-step prep a clinician follows. Step 1, clean the skin vigorously with alcohol prep pads to strip away those oils we just talked about. Step 2, carefully saturate the active electrode's reservoir with the drug. You've got to ensure it's fully soaked to prevent dry spots, which cause burns, but without overspilling onto the adhesive border. Step 3, slap the return or dispersive electrode over a major muscle about 4 to 6 inches away on the same side of the body. This completes the circuit. And step 4, connect the wires. This is where that earlier biophysics lesson is make or break. Matching the wire's polarity to the drug's polarity is the absolute most critical step to ensure the medicine is repelled into the skin rather than just sucked right back into the pad. Once your patient is hooked up, you have to set the dosage. For modern silver and silver chloride electrodes, the golden rule is 40 milliamp minutes. That is your absolute maximum dosage ceiling for a single session to prevent any chemical burns. The math clinicians use here is super straightforward. Total dose is just the current intensity multiplied by the time. So a current of 4.0 milliamps running for 10 minutes gives you that maximum of 40 milliamp minutes. But here's the reality. 4 milliamps can feel incredibly prickly and uncomfortable for a lot of people. So to ensure patient comfort, clinicians will usually drop the current way down, say 1 or 2 milliamps, and just extend the treatment time to 20 or 40 minutes. You gently hit that exact same target dosage, resulting in a much better therapeutic experience. And that brings us to the end of our explainer. It's incredible how a little biophysics and the simple rule of like repels like can totally eliminate the need for a needle. It's a game changer for localized inflammation, pain management, and hyperhidrosis. But I want to leave you with a thought to chew on. As wearable technology shrinks and gets smarter every year, how might non-invasive transdermal treatments continue to revolutionize the future of daily medicine? Just imagine a world where you manage chronic pain not with pills or painful shots, but with a simple, intelligent patch on your arm. The invisible needle is really just the beginning. Thanks so much for learning with me today, and keep exploring.